Hello and welcome to Docplex's News. According to the report provided by MCI to the Parliament, the Indian Medical Registry of Doctors is not updated. As per the report, approximately 75,000 doctors registered during the independence period are still being counted. MCI has suggested that out of the listed 10.8 lakh doctors, only about 80% should be considered as the actual number. Under the Ayushman Bharat scheme, the doctors working in government medical colleges of Madhya Pradesh will have to choose between two modules. First option is to continue private practice after completing their medical college duties, and the second option is to exclusively work in government hospitals for additional 20% incentives. With selection of both these modules, the government doctors would receive benefit of 7th Central Pay Commission. Although telemedicine is considered a good communication channel for managing medical emergencies, it has also led to medical negligence and posed ethical dilemma for doctors. Thus, AME has asked for clear-cut guidelines from MCI on telemedication, as this practice is sometimes considered unethical and illegal. Researchers from the University of Minnesota in the US have developed a 3D printed silicon-based device that could help patients with spinal cord injuries. It is estimated that the surgical implantation of this device in the injured area of the spinal cord would help alleviate pain and regain various functions like control on muscles, bowel and bladder. Study led by an Indian researcher at the University of Alabama in US found that doxorubicin-induced fibrosis in the heart increased apoptosis and impaired the pumping of heart when tested in a mice model. The study also reported that the drug caused wasting syndrome in the heart and spleen. To improve patient care in rural hospitals, the Maharashtra government has initiated a scheme through which doctors working in rural areas will receive additional incentives and higher pay packages of about Rs 3 lakh per month. Since the start of the scheme 6 months ago, 142 gynecologists, 143 anesthesiologists and 71 pediatricians have already been appointed. Following the success, the government has now planned to extend this scheme to other specialties like ENT, dermatology and general surgery. Directorate General of Health Services has stated that the preparation of electronic nicotine delivery system is against the provisions of Drug and Cosmetics Act. Therefore, Delhi government has initiated steps to prohibit the trade, production, supply and distribution of these substances like e-cigarettes in Indian markets to create public awareness. It is estimated that at least 10,000 new jobs will be created under Ayushman Bharat National Health Protection Mission scheme. Health Ministry will also recruit around 1 lakh Ayushman Mitras to assist patients coming to health facilities to avail the scheme. The government has also clarified that NABH is not mandatory for hospitals to get included under the scheme. Until now, about 20,000 hospitals have been linked under this scheme to achieve universal health coverage. According to WHO, dengue is fast emerging as a pandemic-prone viral disease. The incidence of the disease has increased 30-fold over the last 50 years, with about 50 to 100 million infections occurring annually in the most tropical and subtropical regions of the world. In India, the number of dengue cases has increased gradually over the past decade. In 2017 alone, the disease affected around 2 lakh people and claimed 325 lives across the country. According to the National Vector-Borne Disease Control Program under the Union Health Ministry, this year, 14,233 cases have already been reported across the country. With no specific treatment available for the management of the disease, awareness campaign among the population to promote dengue prevention and control methods are of high importance. We urge our community to share their opinion on how can we spread awareness by commenting below. These were the latest happenings in the medical field brought to you by Docplexes, one of the largest online communities of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!